In today's video, I'll be talking about the things you should monitor when your child is not feeling well. Firstly, it's important to take your child to the hospital for proper diagnosis and treatment. After taking your child to the hospital for diagnosis and treatment, while they are still on medication, there are some things you should look out for so that in case you see any of those things, you take your child back to the clinic. Look out for signs of dehydration. Dehydration can occur due to so many things. If a child is constantly running temperature or vomiting, if a child can't seem to take anything down, it could lead to dehydration. Now, when it comes to dehydration in younger ones, you have to look out for less wet diaper. If your child is having less than 4 wet diapers a day, you might want to talk to your healthcare provider. Additionally, for those that still have the soft spots, that is the fontanelle, you might want to look out for a sunken fontanelle. If you notice a sunken fontanelle or a sunken eyes in your little one, it's important to ensure to take enough fluid, and if things doesn't change, you need to go back to your healthcare provider. Furthermore, when a child is having diarrhea non-stop, ensure you increase their fluid intake, and if it doesn't stop, take your child to the pediatrician. Do not take any chances. Additionally, it's important to monitor your child's breathing. If you notice any unusual breathing, whether too fast or too slow, you just have to take your child for proper checkup. Also, you have to keep checking your child's temperature. A normal body temperature should be between 36.4 degrees Celsius to 37.4 degrees Celsius. Any temperature higher than this is considered fever, and you have to take your child to the hospital in order to avoid convulsion and so many other things that can arise from a high temperature. Furthermore, you need to monitor the overall behavior of your child. Now, if you notice that the child, of course, when a child is not feeling well, their activities tend to reduce. Or when you see a drastic reduction in activities, they can't eat, they can't talk, they can't play, and everything is not going so well, then you need to take your child to your healthcare provider. And lastly, before I go today, follow your instincts as a parent. Most of the times, our instincts are never wrong. See you in my next video. Bye.